Almost 8 out of 10 people in India are suffering from foot related problems, and the worst part is that they don't even know that there is an easy solution to their problems. This is exactly why we've started the Good Feet podcast, where I'm joined by Dr. Sarika Jambhulkar, who has helped thousands of patients, including me, to get rid of their foot problems. So, doctor, how did you get introduced to podiatry? How was your introduction into this field, and why did you choose this as a profession?
I did my master's in musculoskeletal and physiotherapy, and still I was keen to get something more specific. I wasn't sure it will be what. And then I got the opportunity to work in the podiatry clinic, and that is where I first introduced about the podiatry. And I got really surprised with the kind of result we can get with the simple foot correction. There are lots of patients I saw suffering with the chronic ailments, chronic heel pain, chronic knee pain, and in very few number of sitting we could address it with the podiatry. So that increased my curiosity, and that's why I invested more into study about the podiatry, and I got my certification from LBJ Medical UK. As much as I learn and I realize it was going to put more impact on the Indian society, as there is no awareness about the foot health in India. And that's why I decided to pursue more in the podiatry practice.
So most of the people suffer from a lot of problems in their feet, including small heel pain, pinching sensation in their feet, and they don't know how to deal with it, how to figure it out. And this can be a sign of your body telling you that there is a bigger problem at hand. So this is why we've started the Good Feet podcast, where we're going to be talking about taking care of your feet and how do you solve the most commonly occurring problems with your feet. So, Dr. Sarika, I want to tackle the most important question here.
Yeah.
Most people in India don't even know what is podiatry. So, can
That's
you
true.
tell us exactly what it deals with and how it helps people?
Sure. So, podiatry is the science which is dedicated for the evaluation or diagnosis of the foot, ankle, and lower limb. Okay. In nutshell, we are actually detectives of the lower limb. We analyze how the person stand and walk, and how is their foot posture. So, like say a dentist can diagnose the dental cavity at earliest and can tell you exactly what problem you have. Similar way, we can analyze your foot pattern and exactly diagnose what is causing exactly stress on which structure and why the certain person walk that way.
All
So
right.
that is all about the podiatry.
All right. So, like I said, not a lot of people in India know about podiatry. What do you think is the reason that people are unaware?
Uh, First, I will say it's a lack of education and the lack of practitioners. Because usually you have most of the specialty doctors available nearby, but the podiatry practitioners are not easily available, and that's why most of the people are not aware about the podiatry. Most of the patient when they come to us, the first consultation they always say ki, we were not aware that there is some specialist for the foot doctor. Okay. And most of them, how they get the reference, they will have some relatives staying abroad, Australia or US, and when they discuss their health issue, I'm having a heel pain and all over the phone, then they are like, okay, you need to see the podiatrist. Then they Google it up and then they find us. One of our patients, she was not sure about whom to consult because she was having some minor nail issue. See, she used ChatGPT. She narrated her symptom on the ChatGPT, and then ChatGPT told her that you need to see the podiatrist. And that's how we get the patients actually. And obviously, one patient who consult us, our each consultation is also kind of a education. So then they are like, okay, my son has this problem, my parents has this problem. Okay, like that they bring more patient. So this awareness about the foot health, that is the main issue with in India.
Okay, so, doctor, can you tell me what are the most common foot related issues in India?
Yeah. So I'll tell you the common conditions which are people generally know, like flat foot. Okay. Then there is condition bunion, forefoot pain, plantar fasciitis. Okay. Now Martin's neuroma. Apart from that, even osteoarthritis of the knee, low back pain. That is also one of the a symptom of the foot problem.
How is lower back pain related to foot health?
Yes, that's a good question. So we have to imagine, like, a feet are foundation of our body. So imagine a car. Okay, our feet are like, equivalent to tires of the car. If that is aligned, your car will rattle, right? So if there is any misalignment in the foot, that will have an impact on the posture in the knee and back as well. So many of our patients we get, they don't have any foot pain, but they have the back pain when they stand and walk. And when we provide the orthotic correction for that, actually their back pain improves.
Okay, so I have two questions more. One is how many people in India, like what is the frequency of people who suffer from these foot problems?
Yeah. So that is very, alarming sign. Let's 3 out of 5 people experience some foot problem in their lifetime. Another magnificent thing is the diabetes. India has become like a world capital for diabetes, and many of the diabetic patient later they experience diabetic foot issues. So that number of the diabetic foot patients are also rising. So now you can imagine the numbers, 3 out of 5. So like every person you meet might have some foot problem, but they just don't know what to do about it.
Like personally, I know when I had a foot problem, it was holding me back in many aspects of my life. So when
That's
you
right.
say 3 out of 5 people are suffering from also, I'm sure like it's holding a lot of people back,
Yes.
and they
Yeah.
need to discover podiatry and come and consult you. So doctor, what are the steps that you are taking to increase awareness about podiatry in India?
So we are regularly conducting courses for the doctors, mainly physio, occupational therapist, or even piano people. There are even diabetic foot surgeons who are getting interested in our course, where we teach them about the lower limb biomechanics, the gait analysis, the kind of conditions the podiatry can deal with, and how you can plan the line of treatment. We take this in online and offline mode, so there are lots of doctors from the even Chennai and other cities, Hyderabad, they are enrolling for the courses.
Who all can attend this course? Is it only for doctors or anyone can join this course?
So it's basically for anyone who has the medical background. So physiotherapist, occupational therapist, PNO who has some background of biomechanics, that is must. Even other doctors like diabetic surgeons and all, even they can attend the course.
Okay.
So medical background is necessary.
What all do you learn in this workshop? Can you tell us?
It start with the basic of lower limb biomechanics, gait training. So walking pattern, the scientific term is the gait. So how to do that gait assessment for the patient, how to diagnose the problem, and how to rectify the problem. So this whole and soul is covered in the course, which is in online and offline mode.
Okay. And so far, how many doctors have joined your course?
More than 100, and there are many physios we have trained. There are many diabetic surgeons from even Chennai, Hyderabad, and other places. They are coming to Mumbai to attend the course.
Okay. And apart from your workshop, is there any other material that someone can study about podiatry?
Unfortunately, no.
Okay. And do you guys have any other training programs?
So we have also institutional training program where we provide the training program from the group for the colleges. So there are certain physiotherapy colleges where we are training the entire their students or their facility. Even hospitals. So for one of the diabetic surgeon, like one of the doctor attended our course, and then we organized separate course for their hospital. So their team of the physio, diabetic surgeons, and other staff attended the course.
Why did you choose to educate doctors?
So it's very simple actually. Suppose we get lots of patient was like, I'm staying in Hyderabad, I have the foot pain. How do I consult you? So if there is no one practicing at that particular location, how do I will advise them? So main reason behind lack of awareness to the common people is lack of practitioners, and we can increase lack of practitioners only by educating the doctors. So physios or even the small setup, if they can include this practice in their clinic, people will have the accessible facility for the podiatry. That's why doctors. So even most of the doctors, either they are like heard about the podiatry, but they don't know how much effective or rather how much easy it's to club into their practice. So you see, India is not a very backward country. We have so many hospitals who are like really advanced in technology and all the stuff, but these are the very basic things we are lacking, because most of the hospital, they will not have a separate foot and ankle specialty, and at a time, even if they have, they don't have the trained staff. Then what is the use, right? When you're visiting any doctor, you just don't see the flashy setup and equipments. First you see the doctor, how much effectively he's diagnosing your problem, then you will trust for the line of treatment, right? So that's why training the doctors is very important.
Do you have any success stories from your trainings? Any of your students doing good?
Yeah, so we have doctors from the Pune, or there's a Kharghar. They have their own physiotherapy setup. Even Thane also. Now they are, educating their patients about the foot problem, and they are practicing the podiatry at least even small level. They are practicing it. And during COVID, actually, when we started courses online, there is one participant. She attended our online course. I haven't seen her actually, but she got interested in podiatry, so she got admission in the foreign country for the masters in podiatry. So recently she contacted me on the LinkedIn that I'm pursuing masters in podiatry now, and very soon she will be coming to Pune to start her the podiatry practice. One more student also contacted me that she has applied from foreign universities for the podiatry, and she had visited the clinic for the guidance. So now students, they are getting, because now everyone want to stand unique, do something different, particularly the new generation. They are very into and curious, so they are now finding the podiatry very interesting, and so now they are opting for further education for it.
And one more question that I had is, like we said, in India there is a lack of awareness. It's a very new subject, podiatry in itself. Abroad, is it mainstream topic? Is it like part of major healthcare?
Yes, it is. Because most of the colleges, they offer the post MBBS also. They can do the diploma in podiatry medicine. That courses is common. And suppose for the heel pain, if you will consult with general practitioner, they will immediately give you a reference for the podiatry. So it's very easy, and that's how most of the foreign people, they know about it. And still, we most of our patient. I had one patient. She is nutritionist herself. She was facing corn issue, and she was doing consultation with one of her client who was from South Africa, and then she mentioned about the corn problem. Then she told her that, if you have the corn, you have to see the podiatrist. She was staying somewhere in, I guess, Panvel or somewhere. From there, she visited, our clinic in Andheri. So you see, now people are traveling so far. If the practitioners become more common, they will have more accessible source for the podiatry.
Can you tell us like why ignoring foot problems can be risky in the long term?
It affects person's quality of life. Okay, so say there is a housewife. She is indoor, most of the time. She is trying to do some exercise, walk, or going to gym, but heel pain shuru ho jata hai. And then she gets demotivated. Then what will happen eventually? She will gain weight, and it also affects the psychologically also, right? That's the only way she can step out and do something for herself. So it affects the person's quality of life. Same goes with the corn and calluses, or say diabetic foot. So imagine there is a wound at the foot. How that, and maybe that can be the breadwinning person for the family, right? He might be the sole earning person. So that's why still with the wound he continue, and then the infection spread in the legs, and then amputation happens, or sometimes it can lead to the death also, right? So diabetic patient, the risk is like really high. So if it is a foot problem, you have to invest into foot health in terms of the changing the footwear, and taking the proactive steps. Like I have given an example of car, right? So you don't wait कि your car tire will burst and then you go to the mechanic, right? कार के टायर में थोड़ा भी हवा कम हो जाता है, immediately you will stop the car and you will get it checked, right? Because you know it will affect the whole journey. The same time, if your foot is at the, or your foot problem is at early age, better get it checked and get it rest, and then you can continue with your active lifestyle later.
So since you were speaking about getting it sorted at an early age, I wanted to know what is the typical age range that you your patients are from? Like, do you only get patients who are from middle age to old age, or do you also get young people coming to you?
So yeah, middle age to later it's more common, but earlier we start, the better is the recovery. So typically we start treating from the age of 4 or 5. Okay, we do have lots of kids around 10, 12 with the flat feet and lots of posture issue. We have lots of women in 30s and 35 who have a corn and calluses or the plantar fasciitis. The only thing is the middle age and the old age things get worsened. Okay, and at a early age, obviously the body respond also very well. Recovery is very fast.
And in country like India, where footwear is so cheaply available, and especially for women, like if you go to Lokhandwala market, you can buy 5 pair of shoes for 1,000 rupees. But these are probably not the best pair of shoes to wear.
Yeah. So recently, I had one patient, old lady. She is in 60s, and she was like, young age में तो I purchased footwear from the fashion street. 100 रुपए का एक footwear, 200 रुपए का, and now I am suffering so much with the foot problem because she has a flat feet. Now her son also has a flat feet who is in 40s, so obviously they are taking care of it, and now they have she has the grandchild who is around 3 now. So she is so much tense now कि उसको भी flat foot है, वो 3 साल की है. So now the people are getting aware. So now they are taking care of their kids and the grandkids also.
So this passes on genetically, flat foot, does it?
Yes, there is. So our foot pattern is, we inherit, like we genetically takes lots of things from the parents. The foot arch pattern is also one of the thing we
Okay.
genetically carry.
So, like if we go back to a little bit into history, how did early humans started developing flat feet? Do you have an idea about this?
So see, earlier people used to walk bare feet. Okay. So usually any person, when the child is born, their foot arch is flat. Okay. At the age of around 1, child will start walking, and that is where their foot muscles get activated and the arch start forming. Now at early, like say ancient times, there used to be natural surface. People used to walk on the sand, mitti. They used to have basically exposure to natural surface. Now our lifestyle is totally changed in particularly metro cities. Since the child is born, he is stepping on this hard concrete tiles. Plus immediately, parents will put the fancy footwear. Okay, so at a time उसको बाहर natural surface पे चला भी रहे, they will make them wear the footwear. So that is also restricting development of their foot arch muscles. Now once they cross age of 5 and if the arch is not developed, there are no chances that the arch will develop later. Okay, so that's why using correction is more important thing. So I am personally I am grown up in the small village. So I have seen the people in the small village, they have very high and pronounced arch. And particularly if I see the people in the metro cities, the chances, incidence of flat feet is more.
And this is actually very right, because I have personally observed this when I was staying in Goa. Like you said, Indian parents, they will put all fancy footwear and keep their kids on a clean surface.
Yeah.
But at the same time, I was seeing these Russian kids, American kids, Australian kids. These parents would just leave their child in the mud, in the grass, out in the field. And I think that's why their genetics also develop much more stronger than us.
That's right. That's right.
So, doctor, like you said, there is so much ignorance about podiatry and foot health in India. How can we change this? How can we make more people aware that such a thing exists and it's good for you?
Education is the important thing. So we take lots of lectures, educational courses for the doctors, physios, and other healthcare professionals also, to teach them about the podiatry, to show them the results about the podiatry. That is one. Because of the social media and the Google, now people are getting aware because they read about their problem and they are getting to know about there is something called as a podiatry. But sometimes everything available online is not right also. You get lots of wrong information also. So recently I saw one video where there is one influencer. He was like, we should walk bare feet. Throw away your shoes, throw away your orthotics. This is not applicable for everyone else. Someone who has like very severe flat feet, maybe they have the height imbalance, it's not going to work. Everyone is not millions women that they can, walk around bare feet. You need to develop that kind of the fitness level. So you should not listen like, everyone available online, because that will not work for your body. Everyone has a, different posture, different walking pattern. Now people are getting aware. We are getting lots of young active people. They are like, how am I standing, how am I walking. What we get runners who ask, what type of shoes I should wear to run. So now people are slowly at least, but the awareness is increasing.
So, like you said, you guys use orthotics in your treatments. I keep seeing a lot of ads online of different brands selling
Yeah.
stuff. So, is it the same or is it any different?
It's totally different, and the online orthotics is totally gimmick. Okay, because most of the time either they are silicone based or very soft footwear. They are feel good products, so they are available online cheaper, so people purchase it. But whatever problem they are facing, say heel pain and all, it actually doesn't relieve their problem. So in the end, they end up in losing their money only. Orthotics need to be customized for individual person. Everyone has a different body type, body weight, different lifestyle. So accordingly, that need to be customized, and of course, the different arch pattern also. So one thing available online will not be suitable for, everyone. Rather, the soft orthotics doesn't suit. It's not suitable for anyone actually. So it
Okay.
is just a waste of time or waste of money.
Okay. So, why are customized orthotics expensive?
So it's very subjective feeling. Most of the patients initially they feel, oh, it's that expensive. But it's the way it is customized for you, and it's going to last for whole year, and it's also going to solve your multiple problems, not just foot pain, but even the knee and back pain also. So that's why the cost goes higher, because we have to work on the durability also. Because if you'll wear something and it will just worn out in 2-3 months, we can't replace it like every 2-3 months, right? So if something which is lasting for whole year, okay, then it's actually overall, if you will see, it's not that expensive. Now, say I had one patient, female patient, she was facing some foot pain. Now she visited some hospital, took the medicine, got the X-ray done. X-ray came normal, so they got the MRI done. MRI also came normal. Okay, and in the end, doctor said it could be because of the flat feet. And then she came to me, and obviously we did, customize orthotics, and her problem got sorted. So you can imagine the cost of consultation at the decent hospital with the MRI, with the medicine and X-ray at one side, and you keep the price of the orthotics. It is actually very much lower than the other remedies.
Okay.
So it is basically investment for the foot health.
Yeah, it's like buying a new car or a new bike. It's going to take you
Rather, I will
places.
say it's taking a insurance.
Yeah, correct.
Okay. So
And-
you are paying, say, a premium, EMI of say 10,000, 20,000, and you are getting 50 lakhs or 1 CR ka protection. It's like that.
Correct. It is going to make your life much more comfortable, I feel.
Yes.
So that was a great introduction to podiatry, and to our viewers who are watching us online. In the next episode, we are going to be talking about heel pain and what are the causes of heel pain, how you can treat heel pain. So if you guys have any questions for the doctor, leave them in the comments below. Don't forget to subscribe to our channel, like, share, follow, and take care of your feet.
Because every step counts.